So today we are going to see sedative hypnotics. So usually there are three terms. First one is a sedative, second one is a hypnotic, third one is a anticonvulsant. There are three, four terms like anxiolytic, sedative, hypnotics. So what do you mean by anxiolytic? These are nothing but the drug which will relieve, which will decrease your anxiety. First of all, what do you mean by anxiety? Anxiety in the sense मराठी में त्याला anxiety म्हणजे काय म्हणतो? Anxiety म्हणजे fear. Everybody has some sort of fear. For example, fear of falling down, fear of height, fear of water, fear of sound and all that. You can call it as a some sort of anxiety. So what is anxiety? It is nothing but the fear of anything. Fear of height, fear of water, fear of fire, etc. etc. Unusual fear. That is nothing but the anxiety. Anxiolytic drugs means those drugs which are used to decrease the anxiety. Sedative means these are the drugs which will produce a calming effect, which will produce a depressant effect on your nervous system and calm you. So if you are excited, suppose that anybody is excited, he is कोई भी एक्साइटमेंट हो चुका है उसको बहुत बड़ी बड़ी बातें कर रहा है वो और चुप ही नहीं बैठ रहा है मतलब जैसे जैसे पागल होता है पागल एक बहुत बड़ी बड़ी बातें करता है और कंटिन्यूअसली वो बोलते रहता है so he is excited so to decrease the excitement okay these drugs are used sedatives means they will produce a calming effect without causing hypnosis or without causing sleep okay these are also a seen as depressant drug anxiolytics are also a seen as depressant drugs sedative also a seen as different depressant drugs only then hypnotics means what hypnotics means any drug that can induce a sleep which will resemble to a natural sleep that is nothing but the sedative that is nothing but the hypnotic and if you still increase the dose of drug so it may it may act as a anticonvulsant and it may then later act as a that later act as a anti that may act as a anesthetic general anesthetic so anxiolytic sedative hypnotics then your anti-epileptic or an anticonvulsant and then your general anesthetics so same drug can act as a in a different in a different action same drug can have a different action depending upon the dose particularly that is true with barbiturates जितने भी बार्बिट्यूरेट्स के ड्रग होते हैं उनको पर्टिकुलरली ये टाइप का एक्शन होता है डोज डिपेंडेंट एक्शन इन अ स्मॉलर डोज सेम ड्रग कैन एक्ट एज एंजियोलाइटिक which will reduce your anxiety okay and I see anxiety depression or fear of anything and same drug if you increase the dose it will act as a hypnotic it will act as a sedative it will calm your nerves okay reduce the excitement but will not produce sleep it can induce a drowsiness आप थोड़ा सा नींद आने जैसे लगेगा आपको but you will not feel sick okay so sedative drugs they will decrease the functionality of your nerves they will depress your nerve okay but they will not produce a sleep okay they are known as a hypnotics now sorry they are known as a sedative now hypnotics means these are the drug which will produce a sleep resembling to natural sleep okay sedative means they are just only depressing your nerve they are just making you calm from the excitement okay so anxiolytic sedative hypnotic and then an anticonvulsant okay and then an anesthetic okay so we are going to discuss about these drugs first sedative hypnotics and first pharmacology of sleep disorder sedative hypnotics and pharmacology of disorders so there are three terms I would like to explain you again okay. Anxiolytics these are the drug which reduce the anxiety which reduce the anxiety or excitement or depression so for example anxiety means fear of something fear of your height fear of water fear of or any kind of phobia water phobia noise phobia or fear then any kind of phobia so they will decrease your anxiety okay now hypnotic drugs will produce sleep resembling to natural sleep they will induce the sleep sedative drug what do you mean by what do you mean by sedative sedative will not produce sleep but it can reduce the excitement it can calm the nerves can it can calming it will calm the patient okay but it will not produce a sleep it will produce some sort of drowsiness but it will not produce a sleep then anticonvulsant these are the drug which will decrease the neuronal excitement okay or it will decrease the convergence these are known as anticonvulsant these are the four terms now normally what happens there are two kind of sleep for individual so in individual human being will have two kind of sleep. Okay, first one is known as a non-rapid eye movement, that is NREM, non-rapid eye movement sleep, and second one is known as a rapid eye movement. There are two kind of sleep in the human beings. So normally you will not feel that there are two kind of sleep in our. When you sleep, you used to sleep. Okay, you feel only one. Okay, first one is non-rapid eye movement. When you feel, okay, so that is divided into four stages. Stage one, when you are awake. Okay, when you are to, you are feeling at some kind of drowsy and you want to go for sleep. So at that time stage zero is there. Okay, stage zero, that is at that time you are awake. You are not sleeping. You can listen anything. You can you can see. Okay, you can think on this think at this stage zero, at which you are awake. Now stage first, known as a dosing. Stage first is known as a dosing, and in this stage you will not see the object clearly. You will not hear the voice clearly. Okay, so that is dosing. Stage 3 is univocal. Again, uh, stage 3 is univocal. Again, same thing. You will not feel. You will not understand what is going on in the surrounding. That is univocal. And stage 3 is known as a deep sleep. Stage 3 is known as a deep sleep. Stage 4 is known as a, again, cerebral sleep. Stage 3 is known as a deep sleep, and stage 4 is known as a cerebral sleep. Okay. Now in the stage 3 deep sleep, you are totally in the peaceful sleep in the stage 3 of sleep, and in the stage 4 of sleep you are almost 75% of your brain is also sleeping. So in that stage 4 cerebral sleep. Okay, these are the four stages of non-rapid eye movement. Okay, why the non-rapid eye movement name is given? Because in this sleep cycle your eyeball will not show any movement. So that is why non-rapid eye movement. Okay? So it is a peaceful sleep. It is a peaceful sleep. It is a peaceful sleep, and in this sleep parasympathetic activity will predominance. So the parasympathetic activity will predominance means what? So all the all the digestive processes will be there in this sleep. So peaceful sleep, all the digestion will be there, all the parasympathetic activity will be there, not a sympathetic activity. Okay, sympathetic activity will not be there in case of NREM sleep. That is non-rapid eye movement. So in this sleep, EEG means electroencephalogram. So which is nothing but the waves in the brain. Whatever the waves are there in the brain, whatever electrical activity is present in the brain, that is recorded by using this instrument known as a electroencephalogram, EEG. Okay, in this sleep, EEG will show alpha rhythm. In the NREM sleep, EEG will show alpha rhythm together with the sleep spindle and no eyeball movement. That's why it is known as a non-rapid eye movement sleep. Now, which one is a peaceful sleep? NREM is a peaceful sleep. Now, second sleep is known as a REM sleep. REM sleep. Okay, so that is known as a non-rapid eye movement. That is known as a non-rapid eye movement. That is known as a second one is known as a rapid eye movement. Second one is known as a rapid eye movement. So what happens in this sleep? So as the name indicates, rapid eye movement. That means here in this sleep, REM sleep, there is a movement of eyeball. There is a movement of eyeball. So obviously this is not a peaceful sleep. So this second type of sleep is not a peaceful sleep. REM movement or REM sleep is not a peaceful sleep. And 70% of the dream, 70-75% of the dream that occurs in this stage, in this type of sleep. So whatever dreaming comes, so dreams may be either vivid, bizarre, or sexual erection can occur in the male. That type of dreams that occurs in the REM sleep. Okay, so आपको बचपन में होता होगा कि यार आपको बचपन में नींद में ही देखो आप बहुत ऊंचाई से गिर रहे हो नींद में ही आपको किसी ने आपके पीछे कोई कुत्ता लगा है नींद में ही आपके पीछे कोई शेर है नींद में ही आपको कोई मार रहा है. So that kind of vivid dreams that occurs in the REM sleep, not in a NREM sleep. That's why this is a REM sleep is not a peaceful. So NREM sleep is a peaceful sleep. Remember, इसके ऊपर भी क्वेश्चन आ सकता है आपका NREM sleep is a peaceful sleep, and REM sleep is a non-peaceful sleep. And this REM sleep will show beta rhythm. This REM sleep will show beta rhythm in the rhythm in the EEG. So whatever EEG, here beta rhythm will be there. In this REM sleep, sympathetic activity will be predominant. So here sympathetic activity will be predominant. As in case of NREM sleep, parasympathetic activity was predominant. Parasympathetic system was predominant. But in REM sleep, rapid eye movement sleep. Okay, so rapid eye movement sleep here, sympathetic system will be predominant, and that's why increase in the heart rate, blood pressure, cardiac output, then peripheral resistance. Okay, so remember NREM sleep is the most peaceful sleep, and it will show alpha rhythm together with the sleep spindle and no eyeball movement. In case of rapid eye movement, so there will be eyeball movement and beta rhythm and increase heart rate, blood pressure, cardiac rate, peripheral resistance. So and most of the dreams that comes from REM sleep. Next one is a classification of your sedative hypnotics. Classification of your sedative. So sedative hypnotics may be classified in a different way. So we are going to see at almost three types of classification amongst the different books. Okay. First one is a selective benzodiazepine receptor agonist, GABA A receptor agonist. In that you have two classes. First one is the benzodiazepine and second one is a non-benzodiazepine. So in the benzodiazepine you have example like diazepam, then oxazepam, lorazepam, clonazepam, nitrazepam, flunitrazepam, midazolam, and a lot of drugs are there. Okay, so only I have mentioned the three drugs. Then non-benzodiazepine in that class Z drugs, zolpicon, zolpidem, and zaleplon. Z kind of drugs. They are known as Z drugs. Z drugs. They are not actually a benzodiazepine. They are a benzodiazepine-like drug. They are a agonist to same receptor. That's why they are known as non-benzodiazepines. And so first category was a selective benzodiazepine receptor agonist. Now another category is known as a non-selective benzodiazepine receptor GABA A receptor agonist. So this was a selective, now non-selective. So in that you have barbiturates or barbituric acid derivative, then non-barbiturates and miscellaneous. So in case of barbiturate, you have phenobarbital, pentobarbital, secobarbital, methoxetal, thiopental, sodium, and all that. There are a lot of drugs. I have mentioned only few here. And then non-barbiturate, for example, chloral hydrate, paraldehyde. Then in that also you can make a subclass like alcohol, like your ethanol, miscellaneous drug like diphenhydramine and promethazine. So most of these antihistaminic drugs, they have one adverse effect of sedation. Antihistaminic drug जो H1 blockers का adverse effect होता है आपका, that is nothing but the sedation. Okay, these antihistaminic drugs are also sometimes used as a sedative hypnotics because of their adverse effect. Remember this classification is very important. You have to remember it. Again, I would like to repeat. So sedative hypnotics are classified into two categories. First one is a selective benzodiazepine receptor agonist. Selective benzodiazepine receptor agonist, that is GABA A receptor agonist. Okay, and second class is nothing but the non-selective benzodiazepine GABA A receptor agonist. So in the first class you have benzodiazepine and non-benzodiazepine. Benzodiazepine में जितने भी benzodiazepine में आता है diazepam, oxazepam, lorazepam, clonazepam, midazolam. Okay, so all these are the benzodiazepine. Non-benzodiazepines में आता है Z drugs, zolpiclone, zolpidem, zaleplone. These are non-benzodiazepine. Non-selective benzodiazepine non-benzodiazepine GABA A receptor agonist. In that you have barbiturates, so phenobarbital, then pentobarbital, butabarbital, secobarbital, methylbarbital, and there are a lot of drugs. Then non-barbiturates like chloral hydrate, paraldehyde, miscellaneous agent in that diphenhydramine promethazine. So out of this diphenhydramine is a histamine receptor antagonist or antihistaminic drug. Okay, so there are one of the most important adverse effect of antihistaminic drug is a sedation. That's why this adverse effect is utilized as a therapeutic effect in this miscellaneous class. Okay, then phenothiazine is a tricyclic. Okay, so it is again a tricyclic antihistaminic. It is antihistaminic as well as antipsychotic also. Again, it will have sedation as a adverse effect. Now you can see here it is a structure of your, it is a basic nucleus or basic structure for your benzodiazepine. Again, when we'll see the same chapter from medicinal chemistry point of view, at that time also I will tell you each and everything, the structural activity relationship and structural aspect of benzodiazepine. Okay, so just see here. So in this here ring, this is known as a benzene ring. Okay, and this is known as a azepine ring. Azepine ring, 7 membered 2 nitrogen atom. So बेंजो डायazepine, बेंजोडायजेपिन क्यों बोलते हैं इसको, बिकॉज यहाँ पे बेंजीन रिंग है, यहाँ पे एजेपिन रिंग है, 7 मेंबर रिंग, ये सिर्फ 7 मेंबर रिंग है एजेपिन, तो उसमें क्या है 2 नाइट्रोजन है, बेंजो डायazepine. There are various kind of substituent over here. Actually, this is a part of your medicinal chemistry. At this position R1, you can have any halogen atom. This R1, chloro or fluoro, fluorine or chlorine will be there. At R2, here either methyl group will be there. Okay. At R2, chloro or nitro group will be there. Most of the time chloro होता है, जैसे बेंजोडाइजेपिन में होता है, नाइट्राजेपम में यहाँ पे नाइट्रो होता है, बेंजोडाइजेपिन में क्लोरो होता है, लोराजेपम में भी यहाँ पे क्लोरो होता है, like that. So यहाँ this position R number 2, chloro or nitro. R1 is nothing but the fluorine or chlorine will be there. Now R2, now R3 क्या हो सकता है, R3 most of the time methyl होता है, so methyl group will be there at R3 position. At R4 position it may be either oxygen or sulfur. At R5 most of the time R5 is empty, but in the some molecules it is a hydroxyl group or acid group. Okay, so if you want to design any kind of product, then you can add acid group over here. Then at R6 it may be either oxygen. Okay, so these are the just structural introduction or structural aspect of your benzodiazepine. So we will see it again and in the medicinal chemistry. So again see the classification of your sedative hypnotics. This is from another book. Okay, benzodiazepines. First is a benzodiazepine, second one is a barbiturate, third one is a non-benzodiazepine derivative, and fourth one is a other. So benzodiazepine, in that you have two subclasses. So these subclasses in the most of the books they have not mentioned such kind of subclasses, but in this book they have given. First one is a short-acting benzodiazepines. In that you have flurazepam, midazolam, and triazolam, midazolam, and flurazepam. So these three drugs are short-acting benzodiazepine. Okay. So याद रखो यहाँ पे midazolam is used as a sedative hypnotic. All these triazolam, flurazepam, they are known as a hypnotic drug, or they are also used as an adjunct for general anesthetics. Flurazepam, midazolam, triazolam. So all these three drugs has a triazole in the nucleus. Midazolam, triazolam particularly these two. Flurazepam में तो नहीं है, लेकिन midazolam, triazolam में triazolam. Triazolam मतलब क्या? Tri मतलब 3, azo मतलब nitrogen. There will be 3 nitrogen in the ring. Okay. Now in the second long acting, so in that you have diazepam, nitrazepam, and prazepam. Then next class is the barbiturate. So in that you have different types depending upon the duration of action. Okay. So you have either long acting barbiturates, okay, like phenobarbital. Remember, इसके ऊपर question आया था. One of the following is a long acting barbiturate. Phenobarbital is a long acting. Intermediate acting barbiturate. So like for example secobarbital. Okay. Short acting barbiturates like pentobarbital, and ultra short acting barbiturates they are known as thiobarbiturates. Remember, ultra short acting barbiturates they are known as thiobarbiturates, and they are used for general anesthesia. Most of the ultra short acting barbiturates they are used as a general anesthetics. Okay, long acting barbiturates they are used as anticonvulsant. Long acting barbiturates they are used as anticonvulsant. Intermediate and short acting barbiturates they are used as sedative hypnotic. ये sedative hypnotic है, ये anticonvulsant है, और ये क्या है, anesthetic. So this is again another classification. We will see another type of classification. So again third classification, sedative hypnotics. Again see, because I am repeating this classification because this is the important part and इसके ऊपर क्वेश्चन 100% आता है. GPAT हो, नाइपर हो, या फिर all kind of exam, कौन सा भी exam. So all kind of exam it is important. Again sedative hypnotics. Okay, first category is benzodiazepine. So now this classification is depending on their use. So hypnotic benzodiazepines, so they will produce a sleep. Okay, diazepam, flurazepam, nitrazepam, alprazolam, temazepam, and triazole. Now anti-anxiety benzodiazepines. So those are utilized for relieving your anxiety, relieving your fear. So diazepam, chlorodiazepam peroxide, oxazepam, lorazepam, alprazolam. So remember, out of this chlorodiazepam peroxide, Fluorodiazepam was the first member of this benzodiazepine family, introduced in 1903. Okay, fluorodiazepam was the first drug accidentally discovered in 1903. Okay, this is the first member of your family. And remember, fluorodiazepam after metabolism is converted into diazepam. Okay, and diazepam itself after metabolism is converted into oxazepam. So I will explain it later on. Then next category of benzodiazepine is anticonvulsant. So those drugs which are utilized as anticonvulsant drugs. So diazepam is there, lorazepam is there, clonazepam is there, clobazam is there. Okay. Then second class of sedative hypnotic is nothing but the barbiturates. Okay. Again, so they are they are they are they are classified according to their duration of action. So longer acting phenobarbital, short acting butobarbital, pentobarbital, and ultra short acting thiopental and methoxytone. Ultra short acting में thiobarbital derivative. And third class is known as non-benzodiazepine derivative. So Z drugs, non-benzodiazepine derivative. Zolpidem, zolpidem, zaleplone, zopiclone. Okay, these are nothing but the Z drugs. यहाँ पे याद रखो Z drugs. They are not a true benzodiazepine. They are not a true benzodiazepine, but they are a benzodiazepine-like drugs. They interact with the benzodiazepine receptor. Z drugs. Then other CNS depressant drugs, for example, this chloral hydrate. Chloral hydrate. Remember, chloral hydrate is metabolized into body into trichloroethanol. Chloral hydrate जो है वो बॉडी में जाके मेटाबलाइज होके ट्राइक्लोरोइथेनॉल बना है. Chloral hydrate. ठीक है. The next one is the triclopros and paraldehyde. Okay. Paraldehyde. It is unstable at room. Guanethidine, then methaquinone, meprobamate, promethazine, chlorpromazine, amitriptyline, and okay. So these two. Chlorpromazine is an antipsychotic also. Antipsychotic drug. Amitriptyline is nothing but the antidepressant. Tricyclic antidepressant. Promethazine is nothing but the H1 receptor blocker. So we'll see now individual drugs. Right? Drug के बारे में देखेंगे. Okay? So let's understand the mechanism of action of benzodiazepines. Okay? How benzodiazepines will act. Benzodiazepines, they are nothing but they are known as a GABA receptor agonist. Okay? Benzodiazepine receptor. When these benzodiazepine drug, they used to bind a GABA receptor and make a complex with it. Okay? GABA is nothing but the inhibitory neurotransmitter in the brain. We have seen that. Okay? So it has its own receptor. Okay? Benzodiazepine receptor is also, that is nothing but the alpha subunit of GABA receptor. Alpha subunit जो होता है, so GABA receptor का different unit होता है. एक ही receptor है, उसके ऊपर different sites होता है. Alpha site, beta site, gamma site, delta site. There are 4 sites at the GABA receptor. Okay. So this benzodiazepine, they binds to alpha subunit. Okay, remember alpha subunit of GABA receptor. Okay, normally GABA receptor at rest. अभी diazepam या फिर benzodiazepine दिया नहीं, तो at rest क्या होगा? At rest, so there is a this chloride ion channel is a closed. At the rest, chloride ion channel is closed. Okay? That means membrane polarization and no change in the membrane polarity. No change in the membrane polarization at the rest. Now when gamma aminobutyric acid is there, okay, alone, when gamma aminobutyric acid is there alone, so what happen in this condition? So for example, this is a GABA molecule. Okay? This GABA molecule in a blue color, that will interact with the receptor and it will increase the opening of chloride channel. So moderate influx of chloride, okay, chloride ions, that will cause hyperpolarization of post-synaptic membrane and there will be inhibitory action or depression. Okay, but now in case of diazepam plus your GABA, so benzodiazepine drug plus GABA receptor, don't साथ में. So when benzodiazepine drug plus GABA receptor, so it will combine and there is a formation of GABA plus benzodiazepine drug benzodiazepine complex. Now this complex, when this complex is formed, there is a violent influx of chloride ions. There is a violent influx of chloride ion. मतलब क्या होगा इसमें ज़्यादा chloride ion inside the cell जाएगा. So there will be severe hyperpolarization of post-synaptic membrane and that will lead to depression or hypnosis. Okay, this is a normal empty receptor. Okay, benzodiazepine site is there at the GABA A receptor. Okay, now at rest when there is a no GABA molecule or there is no benzodiazepine, so at that time chloride ion channel will be closed. So there will be no membrane polarization, or there will be no membrane no change in the membrane polarization when there is only a GABA alone. So GABA will interact with the GABA receptors. It will open the chloride ion channel. So moderate flow of chloride ion channel inside the cell will be there. So membrane will be moderately hyperpolarized, and there will be moderate hypnosis or moderate inhibitory effect. Now, in case of GABA plus benzodiazepine, and your benzodiazepine drug is given along with GABA, so what it shows you, it shows you that benzodiazepine will facilitate the action of GABA. Means it will promote the action of GABA. Along with the GABA, it will promote the action. Okay? So there is a violent influx of chloride ion channel inside the cell and severe hyperpolarization of post-sanguine membrane, and there is a depression. Okay, means depression of nerve, not normal depression. Now we'll see the individual drugs. So here benzodiazepines. First category is benzodiazepines. Remember, this benzodiazepines was introduced into 1903. Okay, during the and first drug was a fluorodiazepine. Okay. Now mechanism of action: they binds to the selectively alpha subunit of GABA A receptor, and this receptor is also known as a benzodiazepine receptor or omega receptor. Now it modulates the effect of GABA. It modulate means it increases the effectiveness of GABA. What is the nature of GABA? GABA is nothing but the gamma aminobutyric acid, which is inhibitory neurotransmitter. तो इनहिबिटरी न्यूरोट्रांसमीटर का ही पोटेंशिएट करेगा उसका एक्शन, तो ऑब्वियसली डिप्रेशन या फिर डिक्रीज इन द एक्साइटेबिलिटी ऑफ न्यूरॉन दैट विल बी देयर. So increase, okay, so it will modulate the effect of GABA, increasing the frequency of chloride ion opening, and increases the effectiveness of GABA by lowering the concentration of GABA required for opening the chloride ion channel, and thus it has a inhibitory effect. Okay, there are two GABA A and GABA. There is a different two sides. GABA, one side GABA A inhibition. GABA A is in the brain. GABA A another, there is present in the limbic system. So inhibition of these two will have different effect. So GABA A inhibition leads to GABA A inhibition in the brain and spinal cord is responsible for the anti-epileptic. GABA A mediated inhibition of chloride ion channel in the brain and spinal cord responsible for anti-epileptic. GABA A, that is known as the omega receptor in the limbic system. GABA A brain में है, that is inhibition of that inhibition of GABA A mediated inhibition of chloride ion channel in the brain and spinal cord responsible for the anti-epileptic. GABA A mediated inhibition in the limbic system. Okay, that is in the limbic system. If it is present in the limbic system, known as the omega 1 receptor, responsible for the sedative, okay, responsible for the sedative, hypnotic, and anti-convulsive. Omega 2 receptors is responsible for the impairment of memory due to chronic use of benzodiazepines. These benzodiazepines will also impair your memory. Okay, मतलब there is one adverse effect of this benzodiazepine known as anterograde amnesia. You might have seen one movie that is known as a गजनी मूवी आपने देखा होगा, उसमें आमिर खान जो रहता है उसको क्या है, भूलने की बीमारी होती है. भूलने की बीमारी वही, दैट इज एंटेरोग्रेड अमनेशिया. सो ड्यू टू ओवर यूज ऑफ दिस बेंजोडाइजेपिन ड्रग्स, so there is one adverse effect known as anterograde amnesia. So that's why omega 2 receptor is responsible for the impairment of memory due to chronic use of these benzodiazepines. Now pharmacological actions of these benzodiazepines, so they have dose dependent action. In a smaller dose they will act as an anxiolytic, they will decrease your anxiety, they will relieve your anxiety in a smaller dose. If you increase dose in a higher dose, they will act as a sedative hypnotic. Decrease in onset of timing of sleep. They will decrease onset of timing of sleep. मतलब आपको नींद आने के लिए जो टाइम लगता है, कोई लोगों को नींद ही नहीं आती, बेड पे लेटेगी 11 बजे और 12 बजे नहीं आती. Okay? So that time for onset of sleep, that is decreased by these benzodiazepines. Prolongs the stage 2 and shorten the stage 3 of REM sleep. शॉर्टन करेगा स्टेज 3 को, स्टेज 4 को, प्रोलॉन्ग करेगा स्टेज 2 को. एंटी कन्वर्जेंट इफेक्ट आल्सो, दिस बेंजोडाइजिपिन आल्सो हैज एंटी कन्वर्जेंट इफेक्ट. They are also a muscle relaxant, okay, and they are also anesthetic. These barbiturates have barbiturates have certain advantages over, these benzodiazepines we have certain advantages over barbiturates. See, barbiturate was first introduced and then later benzodiazepines was introduced. Now benzodiazepines have largely replaced the barbiturates because of they have certain advantages. Okay, say they induce sleep which resembles to normal sleep. They can induce the sleep even when there is a pain. So they can induce the sleep when in presence of pain. आपको अगर दर्द भी हो रहा है तो उसमें भी आपको sleep induce करेंगे. No significant action on respiration. No significant action on respiration means they are not a respiratory depressant. So as in case of barbiturates are the respiratory depressant. So we'll see it about all everything about the barbiturate in upcoming slides. Just try to understand over here why they are superior than barbiturates. Benzodiazepines, why they are superior than barbiturates? Because they will induce the sleep in presence of pain also, and the sleep is nothing but the resembling to natural sleep. Natural sleep is a sleep. Then no significant action on respiration means they are not a respiratory depression, whereas your barbiturates are the respiratory depression. Again, barbiturate will cause you other complications like metabolic acidosis and all that. So these drugs will not cause. Okay, they have less cardiovascular effect. They have a high therapeutic window. These benzodiazepines having high therapeutic window as compared to benzodiazepine. These barbiturates will have less therapeutic window or narrow therapeutic window. Narrow. Okay, and these barbiturates also have drug-drug interaction problem. Okay, but these benzodiazepines will not have low drug interaction, and low potential drug abuse. Barbiturates जो होते that is used that have a high potential to cause drug abuse. This was the pharmacology action of your benzodiazepines. Adverse reactions of benzodiazepines. Adverse reactions of benzodiazepines. Adverse reactions of benzodiazepines. They will cause a dose-dependent CNS depression. Dose-dependent CNS depression. So in smaller dose, they will act as an anxiolytic. So if you increase dose, so they can act as a sedative. If you still increase the dose, they can act as a hypnotic. And if you still increase the dose, they can act as an anesthetic. Now, what are the adverse reactions? So, dose-dependent depression, drowsiness, lethargy, ataxia. That is the main adverse event. Ataxia. Ataxia is the most important. Drowsiness, depression, CNS depression, drowsiness, lethargy, ataxia, visual motor incoordination. Visual motor incoordination. Impairment, behavioral changes. डे टाइम सजेशन दिन में ही आपको नींद आ जाएगी. ओके, डे टाइम सजेशन. एंटेरोग्रेड अमनेशिया. एंटेरोग्रेड अमनेशिया दैट इज नथिंग बट द गजनी. आप याद रख सकते हो गजनी में क्या है कि वो भूल जाता है कुछ समय के लिए. दैट इज एंटेरोग्रेड. रिट्रोग्रेड, एंटेरोग्रेड ऐसे टाइप होते हैं इसके. एंटेरोग्रेड अमनेशिया मींस गजनी प्रॉब्लम. ओके, सो देन अगेन पर्सनालिटी चेंजेस. दीज आर द एडवर्स इफेक्ट. Then benzodiazepines, if administered or if used in the pregnant woman, so it will cause floppy baby syndrome to a newborn. ये एक adverse effect याद रखो. Anterograde amnesia, floppy baby syndrome, then drowsiness, then dose dependent CNS depression, and behavioral changes. Incoordination, motor incoordination. Ignore this. Now, what are the therapeutic uses of these benzodiazepines? So obviously, as like hypnotic, anxiolytic, anticonvulsant, anesthetic, and they are also used in the withdrawal of alcohol. So alcohol withdrawal symptoms may be used करेंगे उसको. This flunitrazepam is a drug from benzodiazepine category. Is a tasteless benzodiazepine and it is referred as a date rape drug. इसके बारे में क्वेश्चन पूछा है. What is by date rape drug? So which of the following is a date rape drug? That is nothing but the flunitrazepam. So it will cause amnesia. Amnesia means loss of memory. So जैसे भी इसको फ्लूनाइट्राजेपम इज नॉट डेट रेप ड्रग बिकॉज इट कॉजेस अमनेशिया. ठीक है, अमनेशिया मतलब लॉस ऑफ मेमोरी. सो रात में क्या हुआ किसी को याद नहीं बिकॉज ऑफ फ्लूनाइट्राजेपम. सो दैट इज नोन एज अ डेट रेप ड्रग. इसके बारे में क्वेश्चन पूछा. नेक्स्ट वन इज अ टॉक्सिसिटी और एंड एंटीडोट ऑफ योर बेंजोडाइजेपिन्स. सो टॉक्सिसिटी क्या होगा? ओवरडोज अगर होगा उसका या फिर ओवर कंजम्पशन एक्सीडेंटल अगर है तो उसमें क्या. So toxicity and antidote. And remember one thing, this benzodiazepine has a specific antidote. So if you got poisoning of benzodiazepine or overdose of benzodiazepine or intoxication of benzodiazepine, in that case there is one specific antidote available. But in case of barbiturates, there is no antidote available, no specific antidote. So obviously other treatment is there, dialysis and gastric lavage and all that. Specific antidote is not available in case of barbiturates. So benzodiazepine, you have specific antidote known as a flumazenil, known as a flumazenil. Flumazenil. Remember this, it was already asked in the question. It was already asked in GPAT as well as other exams. So flumazenil is specific antidote for benzodiazepine overdose, and it is nothing but the imidazole derivative, imidazole benzodiazepine derivative. It is a competitive antagonist for benzodiazepine receptor. A competitive antagonist for benzodiazepine receptor. What is diazepam? Diazepam is a agonist. Now it is a competitive antagonist. Competitive antagonist, and this can reverse all the modalities, all the symptoms of benzodiazepine poisoning. It can replace. It can. It can regain all the function. So whatever serious depression caused by benzodiazepines, that can be reversed by this clomazepine. Remember, and this is indicated in the patient with raised intracranial pressure after head injury. Okay, and this clomazepine, okay, clomazepine is also clomazepine is also contraindicated in patient with intermittent porphyria. तो क्या होता है, if there is an increased level in the porphyrins in the blood, that is a intermittent porphyria. So porphyrin is responsible for your formation of. Next one is bicaculin. Bicaculin is the drug. Bicaculin is a non-competitive inhibitor of benzodiazepine. Non-competitive inhibitor of benzodiazepine. Clomazepine is a competitive inhibitor of benzodiazepine receptor. Then remember over here one thing I have not mentioned over here. Beta carbolin. Beta carbolin. Beta carbolin. That is known as a beta carbolin is known as a partial agonist to benzodiazepine receptor. Carbolin. Beta carbolin is a partial agonist to benzodiazepine receptor. Now non-benzodiazepine receptor agonist. Non-benzodiazepine receptor agonist. तो इनके स्ट्रक्चर में बेंजोडाइजेपिन का रिंग नहीं होगा, कुछ अलग रिंग होगा, but they will act on the same receptor, that is nothing but the benzodiazepine receptor. So non-benzodiazepine receptor agonist. So in that you have Z kind of drug, Z. So zolpiclone. Zolpiclone consists of a cyclopyrrolone ring. इसमें cyclopyrrolone ring है. Then zolpidem, it will have a imidazopyridine ring. Then zaleplone, it will have a pyrazolopyrimidine ring. They are also known as Z agents because they are known as Z agents. Okay, and are benzodiazepine receptor agonist, has greater selectivity for omega 1 receptor than omega 2 receptor. They will have similar pharmacological actions and pharmacological uses as like benzodiazepines. They are relatively safe. They will have less adverse effect. They are newer drug. Next one, we'll see the barbiturates. So you can see barbiturates are nothing but they are also sedative, hypnotics, anticonvulsant, anxiety agent. Now what is barbituric acid? It is a condensation product of your urea and malonic acid. Remember, condensation product of your urea and malonic acid. So यूरिया मेलोनिक एसिड को जब रिएक्शन होगा तो आपको क्या बनेगा, आपको बनेगा बार्बिट्रिक एसिड. ये हो गया आपका मेलोनिक एसिड, ये हो गया यूरिया प्लस मेलोनिक एसिड, यू आर गेटिंग हियर बार्बिट्रिक एसिड. नाउ दिस बार्बिट्रिक एसिड इज अ डिवॉइड ऑफ एनी फार्माकोलॉजिकल एक्शन. ये बार्बिट्रिक एसिड को सीरियस डिप्रेशन इफेक्ट नहीं है, इट इज नॉट एंजाइटी, इट इज नॉट सेडेटिव, इट इज नॉट हाइप्नोटिक. As it is, barbiturate acid is not having any therapeutic effect. But when this carbon number 5, okay, these two hydrogen when replaced with either any aliphatic side chain or aromatic side chain. तो अगर यहाँ पे कुछ aliphatic side chain डाला CH2, CH3, CH4 ऐसा कुछ, या फिर यहाँ पे कुछ phenyl डाला, so then this become active. Then this molecule will have your anticonvulsant activity, anxiolytic activity, and CNS depressant activity. Okay? So substituted barbiturates are only effective, they are only active, not barbituric acid. So इसके पीछे भी एक स्टोरी हमारे सर ने हमको बोली थी, I would like to share with you. So इसके पीछे एक स्टोरी है, कैसे उसका मतलब कैसे उसका नोटिस हुआ, ये कैसे उसका डिस्कवरी हुआ. So how this barbituric acid was discovered. So there was one story my teacher used to tell me कि मान लीजिए कि एक बच्चा है और वो फॉरेन में कैसा होता है, फॉरेन में देखो वहाँ पे ज़्यादा मैक्सिमम ये न्यूक्लियर फैमिली होता है, यहाँ पे अपने पास पूरा फैमिली होता है. वहाँ पे न्यूक्लियर फैमिली होता है, वहाँ पे हम दोनों, बच्चा और एक कुत्ता, इनकी फैमिली हो गई कंप्लीट. तो वो बच्चा है, वहाँ पे बच्चा खेल रहा था, वहाँ पे कुत्ता था, ठीक है। बच्चे के हाथ में था एप्पल, एप्पल वो खा रहा था। बच्चा मालूम है आपको, एप्पल खाता है नीचे गिरा देगा, फिर थोड़े टाइम पे बाद में आएगा खाएगा, ऐसा, ठीक है। तो एप्पल खाया था उसने और नीचे गिरा दिया, और सडनली वहाँ पे क्या हुआ था, वहाँ पे जो कुत्ता है, कुत्ते ने सुसु किया था, ठीक है। और वो सुसु वो एप्पल में जाके गिरा। Now what is mean by urine? Urine is nothing but the urea, okay. And what is apple? Apple में रहता है malonic acid. There is a condensation of urea and malonic acid. And there is a barbiturate acid, okay. And this when वो जो बच्चे ने फिर से अगर वो एप्पल खाया तो उसमें क्या होगा, उसमें बार्बिट्रेट एसिड चला गया, बाद में उसका मेटाबॉलिज्म होके फिनोबार्बिटोन बन गया, वो डिप्रेशन में गया, सो गया, उसको नींद आ गई, डॉक्टर के पास लेके गए, ये क्यों हुआ है, तब जाके पता चला बाद में सब रिसर्च करके, यार ये ऐसे हुआ। सो दैट इज स्टोरी बिहाइंड दिस। So remember, urea and malonic acid, when condensed together, they will give you barbituric acid. We'll see individual barbiturates. So barbiturates, individual barbiturates. Barbituric acid is nothing but the condensation product of your malonic acid and urea, and it is a devoid of any pharmacological activity. Okay, when unless and until it is substituted. Now classification of barbituric acid. चार बार हो रहा है, longer acting class, longer acting drug. So those drugs which will have a duration of action 8 hours or more, known as a longer acting. Okay, ये भी याद रखो, ड्यूरेशन कितना है, 8 hours. So the example is phenobarbital. Intermediate acting में क्या है, intermediate acting, so it will act for around 4 to 8 hours. Amylobarbital, butabarbital, pentobarbital. Short acting barbiturates, so it will have duration of action less than 4 hours. Less than 4 hours अगर duration of action है तो that is a short acting. So for example secobarbital. Then ultra short acting barbiturates, so those are known as intravenous anesthetics. Those are known as intravenous anesthetics. For example, thiopental, sodium, thiopental, methotrexate, thiopental and methotrexate. They are known as intravenous intravenous anesthetic or ultra short acting barbiturates. They are only used for induction of anesthesia. Ultra short acting. Intermediate acting and short acting, they are used for sedative hypnotic as a sedative hypnotic. Longer acting is also used for sedation purpose, but mostly used for anticonvulsive. What is mechanism of action? So mechanism of action of barbituric acid. They binds to beta subunit of GABA A receptor and increases the duration of opening, not frequency. So frequency is increased by benzodiazepines. क्लोराइड ओपनिंग का, क्लोराइड चैनल का जो फ्रीक्वेंसी है, कितना ज़्यादा फोर्सफुली फ्रीक्वेंसी ज़्यादा है क्लोराइड का ओपनिंग का, दैट इज डन बाय benzodiazepines. Now here in case of barbiturates, they only increase the duration of opening for chloride ion channels. मतलब टाइम ज़्यादा टाइम ओपन रखेगा कौन, बेंजोडाइजिपिन. लेकिन सॉरी बार्बिटूरिक एसिड, बेंजोडाइजिपिन क्या करेगा, ज़्यादा क्लोराइड अंदर जाए ये देखेगा, बार्बिटूरेट्स क्या देखेगा कि ओपन रह जाए चैनल, कितना जाएगा उसको कुछ लेना नहीं. By binding to a beta receptor, beta subunit of your benzodiazepine receptor, these barbiturates will increase the duration of chloride ion channel opening. There is a GABA gated chloride ion channel and hyperpolarizes the post-synaptic membrane. In the large doses, they directly open the chloride ion channel and also inhibit the excitatory glutamate receptors. Okay, so initially they will increase the duration of opening of chloride ion channel, GABA gated chloride ion channel, and hyperpolarize the post-synaptic membrane that leads to depression effect. Okay, but in large doses, they can directly open the chloride ion channel, also inhibit the some excitatory neurotransmitter like glutamate, and they also potentiate the action of GABA. These are the mechanisms, but the barbiturates are not selective in the action. They are not selective as compared to benzodiazepines. Benzodiazepines are selective in action. Remember this. Pharmacological actions of your benzodiazepine. Post-dependent serious depression. They anxiolytic, sedation, hypnosis, sleep resembling to natural sleep. Cannot induce sleep during pain. Okay, but these barbiturates cannot induce sleep during pain. But benzodiazepines was able to do more hangover than benzodiazepine. Hypnotic dose of barbiturate can cause motor incoordination. Barbiturates are anesthetic. For example, thiobarbiturates or ultra short acting barbiturates. So thiobarbiturates होता है, they are nothing but the ultra short acting barbiturates. Okay. They are also anticonvulsant. For example, pentobarbital and mepobarbitol. Barbiturates can cause dose-dependent depression of respiratory center. Dose-dependent depression of respiratory center, myocardium, and vasomotor center. That's why benzodiazepines are more superior than these barbiturates. Hepatic microsomal enzyme inducer. They are a potent microsomal enzyme inducer. Hepatic जो लीवर में मेटाबॉलिज्म करने वाले एंजाइम है उसको इंड्यूस करेगा, उनका प्रोडक्शन बढ़ाएगा. Okay? So obviously it will have other drugs if taken with the barbiturates, their metabolism will be accelerated. It increases the level of delta amino levulinic acid ALA synthesis. Delta amino levulinic acid, then aldehyde dehydrogenase. Okay, so it induces this kind of enzyme. So phenobarbital increases the hepatic clearance. Phenobarbital increases the hepatic glucouronyl transferase in and bilirubin binding protein. Bilirubin binding protein and stimulate the metabolism of bilirubin. So this property can be utilized over another condition, in the another condition. For example, neonatal jaundice. Neonatal jaundice, जैसे बच्चों में jaundice हो गया तो उसमें phenobarbital देंगे. आप बोलेंगे सर कैसे phenobarbital तो आपका सेडेटिव हिप्नोटिक है तो jaundice के लिए कैसे करेंगे? So because it increases the hepatic glucouronyl transferase enzyme and bilirubin binding protein and stimulate the metabolism of bilirubin. Now what happens in the jaundice? In the jaundice there is increased level of bilirubin in the blood. Okay, में blood में यूरिन bilirubin का लेवल बढ़ता है तो उसको बोलते हैं अपन jaundice. हिंदी में बोलते हैं पीलिया. ये पीलिया. This phenobarbital increases the or stimulate the bilirubin binding protein. So free bilirubin will be not be there in the blood if there is a large amount of proteins available for binding, and also increases the metabolism of bilirubin. So that's why sometimes this phenobarbital also used in the treatment of neonatal jaundice. Okay? Remember, we will see it again in the next. Next one is a absorption, distribution, metabolism, and elimination of this phenobarbital. So not each and every drug will be discussed. So phenobarbital will be discussed as a prototype of this barbiturates, and in comparison with that, other drug will be discussed in a short manner. Maximum absorption occurs from the stomach because they are a weak acid, and salt of barbituric acid are absorbed uniformly through the GIT. They are a potent enzyme inducer. Remember, what are the different adverse effects of barbiturates? Adverse effect of barbiturates. First one is intolerance. Your body will not tolerate the barbiturates. So normal reactions like excitement, then nausea, vomiting, diarrhea, headache. Okay. Barbiturates may produce neuralgia. Neuralgia means nerve pain. Myalgia means muscle pain and arthritis. So that your body will reject this barbiturates most of the time. That is nothing but the intolerance. Reactions like excitement, nausea, vomiting, diarrhea, headache, barbiturate may produce myalgia, neuralgia, and arthritis. Next one is a megaloblastic anemia. Megaloblastic anemia on long-term use. Long-term treatment of barbiturates can result in the megaloblastic anemia. डिप्रेशन ऑफ फेटल रिस्पिरेशन. जो बच्चा है पेट में, माँ के पेट में जो बच्चा है, अगर माँ मतलब if pregnant woman takes these barbiturates, so there may be chance of depression of respiration of fetus. That is another disadvantage. Then it is contraindicated in case of porphyria. It can induce porphyria. Porphyria means what? It can increase the level of porphyrin in your blood. Porphyrin जो होता है उसका लेवल बढ़ा देगा. So that's why these barbiturates are absolutely contraindicated in case of intermittent porphyria. Okay? So यहाँ पे लिखा नहीं है लेकिन बोल रहा हूँ मैं. Then next is drug automatism. ये बहुत इंटरेस्टिंग चीज़ है. इंटरेस्टिंग आइटम है ये drug automatism. तो इसमें क्या होता है? Drug automatism is the adverse effect of your barbiturates. So what happens? Because of confusion and amnesia, patient may take repeatedly dose at night and poison himself. The phenomenon is known as a drug automatism. ठीक है, मतलब अगर किसी को बार्बिट्यूरेट का ट्रीटमेंट चालू है, सब पेशेंट को नहीं होता है, कभी कभी हो जाता है. मोस्टली इन ओल्डर एज जेरियाट्रिक पेशेंट है, अगर उनको बार्बिट्यूरेट का ट्रीटमेंट चालू है तो उनमें क्या होता है कि वो भूल जाते हैं कि मैंने शाम की दवाई ली या नहीं. वो भूल जाएंगे और भूलने के बाद क्या होता है, वो बोलेंगे, उनको याद आएगा दवाई नहीं ली, फिर से वो लेंगे. ठीक है, और लेने के बाद फिर से वो भूल जाएंगे कि मैंने दवाई नहीं ली, फिर से वो लेंगे. दैट्स व्हाई the patient will poison himself by taking repeated doses of these barbiturates. Phenomenon is known as a drug automatism. Okay, that is a adverse effect of your barbiturates. Remember this. Next, again, tolerance and drug dependence. Tolerance मतलब क्या? So large doses of drug will be required to produce same pharmacological action, which is produced by normal therapeutic dose. So अगर आपको जैसे मैंने बोला है ना, जैसे आपको आज अगर आपने पीना चालू किया तो आज आपको एक पैक से कुछ नहीं होगा, आप 15-20 दिन तक कोई दिक्कत नहीं, एक पैक में ही टूल हो जाएंगे। 15-20 दिन के बाद क्या होगा, आपको वो टूल होने के लिए 2 पैक लगेंगे, ठीक है, और फिर 2 महीने के बाद क्या होगा, वो उतना ही टूल होने के लिए आपको 4 पैक लगेंगे। This is known as a tolerance. So if increase in the dose is required to induce the same to produce the same pharmacological action or same pharmacological effect, which is normally produced by normal therapeutic dose. Okay, that is nothing but tolerance. That is nothing but the tolerance. Or these barbiturates can result in the tolerance. They can develop tolerance and drug dependence. Okay, drug dependence also. Repeated administration result in the tolerance and drug dependence. Next one is a drug interaction. So these barbiturates will have drug interaction with these like CNS dependent, other CNS dependent drugs, in MAO inhibitors, okay, diazepines and alcohol. So they will have a drug interaction with these drugs like CNS depressant drug, other CNS depressant drugs, in MAO inhibitors, benzodiazepine, alcohol, etc. Now what are the therapeutic uses? उसका use क्या है? Uses of barbiturates. So they are used as a hypnotic, anticonvulsant, general anesthetics, and also used in the psychosis. Okay, so one more use, not because of their hypnotic property or CNS depression property, but that is the use is because of their adverse effect. So it is also used in the neonatal jaundice of the enzyme induction, regulation of gluconyl transferase, and increase in the amount of bilirubin binding protein and increasing the metabolism of bilirubin. That's why this adverse effect can be utilized as a therapeutic effect of this, and that's why this phenobarbital is sometimes used in the neonatal jaundice. याद रखो इसको, इसके बारे में क्वेश्चन ऑलरेडी आ चुका है. टॉक्सिसिटी, so ingestion of large doses accidentally or with the suicidal intent. मैंने बहुत बार बोला है आपको, पॉइजनिंग में भी ड्यू टू डिफरेंट इंटेंट. ओके, पॉइजनिंग क्यों हो सकता है आपको, it may be either your professional, because of the professional, okay, profession. फॉर एग्जाम्पल इन केस ऑफ फार्मिंग, आप जब जो भी कोई भी इंसेक्टिसाइड स्प्रे करते हो उस टाइम पे एक्सीडेंटली वो आपके स्किन के ऊपर आता है, दैट इज मे बी ड्यू टू प्रोफेशन. पॉइजनिंग में भी आइदर एक्सीडेंटल मतलब आपको मालूम नहीं वो क्या है और आपने खा लिया, दैट इज एक्सीडेंटल. इट मे बी आइदर सुसाइडल, किसी ने आपको मारने के लिए वो दे खिलाया, आपको पता ही नहीं चला किसने खिलाया आपको, दैट इज नथिंग बट द सुसाइडल इंटेंट. ओके, so either ingestion of large doses by accidentally or by suicidal intent, okay, there is a poisoning. Okay, and poisoning symptoms you can easily आपको समझ में आएगा वो poisoning symptoms क्या होगी. Obviously CNS depression will be there, okay, dose dependent CNS depression will be there, motor incoordination will be there, nausea, vomiting, okay, respiratory depression, this kind of symptoms, okay, restlessness, tremors, etc. I have not listed the symptoms of toxicity. Now, what is the treatment for toxicity? Gastric lavage. Gastric lavage means washing of your stomach. Stomach को wash करना पड़ेगा. Gastric lavage, endotracheal intubation, forced diuresis करना पड़ेगा. Forced diuresis by using either mannitol or furosemide. So in some you can consider as a furosemide is a antidote. Okay, you can consider it as a specific antidote, but it is not a, it is a specific antidote is called when another drug will interact with the same receptor at the action, but this drug will not act on a benzodiazepine receptor. So sometimes it may be called as a specific antidote, furosemide. Okay, तो बोला है मैंने आपको whenever we were seeing the very first lecture. So if acid drug is there, so alkalization of urine will help you to eliminate that drug easily. So if drug is a basic in nature, so acidification of urine is helpful to eliminate that drug. So again, alkalization of urine, acids, then hemoperfusion, okay, or prophylactic antibiotics means if ये सब होने के बाद कोई infection ना हो इसलिए prophylactic antibiotic. So these are the measures or these are the points for the treatment of benzodiazepine overdose or barbiturate overdose or poisoning. Next one is a other drugs, other sedative hypnotics. So other category के drug, so उसमें आता है आपका chloral hydrate, paraldehyde, etc., alcohol, etc. First one is a chlorhyl hydrate. Okay, now it is metabolized to ट्राइक्लोरोइथेनॉल. इसका मेटाबॉलिज्म होके ट्राइक्लोरोइथेनॉल बनेगा, याद रखो. It exerts hypnotic action. Okay, adverse effects are like allergic skin reaction. It has an unpleasant taste. Taste अच्छा नहीं है. Rarely used in the therapeutics nowadays. It is not used nowadays. But आपको यहाँ पे क्वेश्चन अगर आ गया ट्राइक्लोरोइथेनॉल इज एक्टिव मेटाबोलाइट ऑफ chloride. Chloride can be metabolized inside the body into trichloroethanol. Next category is drug with sedation as a prominent side effect. तो ऐसे ड्रग जिनका सेडेशन एडवर्स इफेक्ट है वो एडवर्स इफेक्ट यूटिलाइज किया जाता है एज ए थेरेप्यूटिक. सो एंटीसाइकोटिक ड्रग लाइक क्लोरप्रोमाजिन, एंटीडिप्रेसेंट ड्रग लाइक amitriptyline, then your antihistaminic drug like diphenhydramine, promethazine, they have adverse effect of sedation, and that sedation is utilized here. Okay. There are certain anticholinergic drugs like scopolamine, which is a CNS depressant. Atropine is CNS stimulant. याद रखो यहाँ पे. Okay. Atropine, scopolamine एक ही कैटेगरी ड्रग है, both are muscarinic blocker, but atropine is a CNS stimulant and scopolamine is a CNS depressant. यहाँ पे भी याद हो. Whenever we will take that drug acting on ANS, at that time I will tell you. Next category is known as a paraldehyde. So it is given by rectal route or intramuscular route to induce the hypnosis. It can cross the placental barrier again and may delay the establishment of breathing in newborn. So it may delay the breathing of newborn. So it should be contraindicated in the pregnant woman. It is a irritant drug to rectal and gastric mucosa. It can cause tissue necrosis and nerve damage. Now this paraldehyde is decomposed into acetaldehyde and acetic acid in presence of light and temperature. So therefore it should be prepared freshly and stored in a, okay, it is not stored, ये इसका storage वगैरह नहीं करते. It should be freshly prepared, therefore it should be used within paraldehyde. Remember one additional point: sleepwalking, night terror. Sleepwalking and night terror. Night terror, sleepwalking are the mild symptoms of severe manifestation of insomnia. और आपको नींद नहीं आती बहुत दिन से, so sleepwalking may be there. आपने देखो नींद में चलने की आदत, that is because of the severe insomnia. Insomnia means lack of sleep. Insomnia मतलब क्या होता है? Lack of sleep. If there is a lack of sleep, आपको अगर नींद नहीं आती, that is known as insomnia. और आपको बहुत दिन से नींद नहीं आती, so that may result in the sleepwalking or night terror. Nightmares are commonly known as bad dreams. Nightmares are commonly known as bad dreams. तो आपको अगर कोई सपना आता है, ठीक है, कोई सपना आता है आपको, कोई सपना आता है which is a bad, that is known as a nightmare. जैसे आपको नींद में किसी ने गोली मार दी, नींद में बहुत कुछ आपका चिल्लाते हो, मार रहा है कोई, causing insomnia. There are certain drugs which can produce insomnia. So what are these? For example, CNS stimulant like ephedrine, amphetamine, caffeine, nicotine. Okay. These drugs can induce insomnia. Remember. Now analgesiant, nasal decongestant. Okay, analgesiant and nasal decongestant. They can also produce your insomnia. For example, buspirone, levodopa, amantadine, chloroquine, then metronidazole, then diuretic drugs, systemic glucocorticoids, MAO inhibitors, and selective serotonin reuptake inhibitors. These drugs can also produce insomnia. This was regarding the sedative hypnotic chapter. Now we'll see what is the time. Okay, we'll see in the next lecture. Remaining alcohol जो है बाद में देखेंगे.